dentist at the Dental Cube located at Singh Sandra, Bangalore. Thank you, BabyChakra, for giving me this wonderful opportunity to have a live session where I'll be talking to you about 8 reasons that cause gum diseases in kids. When I say oral health, the first thing that comes into your mind is your teeth. While your child's teeth are important, the gums are important too. The gums help in holding the teeth and supporting them in place. First comes first, what is gum disease? It is basically nothing but infection in the connecting tissues. So, if the gums aren't given the proper TLC that they deserve, it can lead to gum disease, which is technically known as periodontal disease. First things first, what is gum disease? It is basically an infection in the connecting tissue. Just like in adults, right? The kids also have bacteria in the mouth. The bacteria mixes up with the saliva, the mucus, and the food debris to form plaque. This plaque is a sticky bacterial film that is formed on the surface of the teeth and along the gum line. And if this isn't removed with proper brushing, it can lead to infections. But the good news over here is the children, they're more susceptible to develop only gingivitis, which is a milder version of the gum disease. The aggressive version is periodontitis, which is very, very rare in kids. So now let's move on to what are the reasons that cause gum disease. The first and the primary cause is poor oral hygiene. When the plaque is formed and no proper oral hygiene is maintained, the plaque hardens to form tartar. Okay, the tartar cannot be scrubbed away at home with your regular toothbrush. You need to visit a dental office where specialized tools are used by the dentist to remove the tartar. Second one is certain illnesses and diseases like diabetes and autoimmune diseases. These put the patients at a higher risk of developing gingivitis or any other kind of gum disease. Medications such as antihistamines, decongestants, or antidiarrheal medication, they develop, what they cause is they cause the dry mouth, that is, decrease in the production of saliva. But saliva is like super important because it helps in washing away the debris, the bacteria, and the plaque, and it also maintains the pH in the mouth. The next one would be mouth breathing. This is again correlated to dry mouth. Do you get me? So, again, it is increasing the risk of developing gingivitis. The next is diet. A diet that is rich in sugar and starches will increase the odds of a kid developing gingival disease. So you try and inculcate a diet which is rich in nutrients and minerals that support the periodontal health of the teeth and the gums. Hormonal changes, like those that occur during pregnancy, puberty. I'm so sorry about that, puberty. What happens is the blood circulation in the gum amps up at that time. That is in response to the increase in hormones like estrogen and progesterone. This is mainly caused in the teenage group, and if it isn't treated at time, it might lead to the aggressive version, that is periodontitis. The next would be grinding and clenching. In a few kids, right, it is very obvious, but in a few of them, it isn't obvious because you won't be aware because it is something that happens at night. The kid usually wakes up with a sore jaw. That is the reason behind grinding and clenching, and that also leads to gingivitis. The last reason would be genetics. If you have a family history of of periodontal disease, the kids are also more susceptible to develop any kind of gingivitis or periodontitis in their later stage of life. Not now that we know what are the causes and what is gum disease, let's focus on what are the symptoms. Like if you're at home and you're looking at your kid, they're complaining of pain. What are the symptoms or what are the signs that you need to look for? First one would be swollen or irritated gums. Okay, the gums would be bright red in color. A healthy gum is light pink in color. So anything other than light pink is a problematic gum. The second one would be bleeding while brushing or when you floss. That would be the problem. The third one would be bad odor from your mouth. That is, even after a couple of times of brushing in a day, even if you're brushing twice a day and if you're still having bad odor, then it is a case of gum disease. Then you have receding gums, like if you observe your gums are being toned down from the teeth. That is more, all these kind of symptoms are there in the aggressive form. And if you see change in difference in the bite, that is when you bite your upper and the lower teeth, and if you see that there is a difference from how it was before, then it is a problematic gum. Now that we've seen the symptoms and the cause, let's move on to the treatment. It is as simple as getting a professional cleanup done, a thorough professional cleanup done at the dental office, and then following it up with a dedicated home care routine. I gave you good news of saying that the kids won't develop periodontitis at a younger age, but they have gingivitis. Now, if you want to prevent even that, what are the measures that you could take? That is what I would want to explain to you. I have summed up into three important preventive measures. That is the first one, excellent. You have to establish an excellent oral hygiene habit from early on. Early on, as in, it is funny that I have to say that, but it is as soon as your child erupts the first teeth. Start brushing with a soft bristle toothbrush and using a tiny smear of toothpaste that shouldn't be larger than a grain of rice. Okay, and as the child grows up into like a childhood, and then even later on, help encourage them, motivate them, and get them involved in brushing twice daily. Show them videos where how you can floss, explain the importance, and let them know. Make it a fun activity as a family of how many over you are there at home. So you kind of brush together and make it like a fun activity so that they don't get bored. Because I know how kids are when they have to brush when they grow up. When it's the starting stages, they'll be like really happy to do it. They'll brush throughout the day, but later on they'll just be fussing around to even brush their teeth. The second one would be encourage to eat a healthy diet that is rich in minerals and nutrients that support the dental health. Cut down on sugars and starches like that of those candies and chips, because trust me, once the diet is rich in sugars and starches, it becomes like the bacteria are having a feeding frenzy. The third one would be visiting the pediatric dental office. If I say visit once in 6 months, would that be too much to ask for? It might be for a few parents who are working and who are busy. So what I would suggest is, unless you don't have any major problems, unless your kids don't have major problems, visit at least once in a year. If it is kids, right? Make sure that you visit a pediatric dentist, because the pediatric dentist will not only evaluate the teeth but also the periodontal tissue. He's going to guide you on what to do, what not to do, and how to do a proper oral hygiene at home. I think this is all that I could sum up, and if you have any other questions, you can ask me. Um, Thank you again, BabyChakra, for giving me this opportunity. And if you guys have found this session of mine helpful, please do support me and follow me on BabyChakra. I also have an Instagram page, and I go by the name O Positive Life, where I share my life with my kids. I have 3 sons, 2 toddlers, so there's a lot of noise, a lot of drama, and a lot of fun. I'm sure you're going to find it really interesting. So see you there.